I'm going to get started, and the focus is going to be on hearing loss. And feel free, note your questions. I'll be able to answer them at the end, and some of them might even be answered as we are going through this session. So the focus is on hearing loss. First of all, and most important, is how to prevent hearing loss. And then secondly, how to manage the organizational risk that arises out of these cases of hearing loss. I've done this talk to run along a process flow similar to what an employer is expected to do. Therefore, if one follows this session, they should be able to implement a fairly adequate system at their workplace. But again, in an hour, we really can't cover it all. So this is just an overview. There's a lot that an employer needs to look into in addition to this. So we're going to look at the Act, what it talks about briefly. Then we're going to define what are these terms that we shall be encountering through this conversation. And then we'll look at how do you determine noise levels and if there are concern. And then we're going to look at managing noise in terms of what we call the hierarchy of controls. And then monitoring exposure effects to that, to the employee when they're exposed to too much noise. And then we'll talk about setting baselines. And we'll look at hearing loss, what happens when it goes wrong. And then finally, what do you do as an employer when it goes wrong? Now, within our law, the Occupational Safety and Health Act, we have something called the Legal Notice number 25, which are the Noise Prevention and Control Rules of 2005. And this is an update of the Noise Prevention and Guidelines of 1996. Now, these guidelines define, so I'm going to go do an overview of what is contained within the Legal Notice number 25. But I'm hoping that you shall all manage to go and read it at your time when you have some time. The legal notice number 5 defines the noise exposure limits in our Act. It outlines the components of a hearing conservation program. So literally the whole document gives you a hearing conservation program. It defines the minimum durations for keeping data records. So if you undertake occupational medical examinations, records generated from that exercise, because there are some legal implications. Guidelines to keeping workers informed. So unlike what is actually done out there, a lot of workplaces do not inform workers of the noise levels within the workplace, of the plans that have been put to protect their hearing, of what to watch out for in terms of signs and symptoms, and how to report. So all these guidelines are shared because it is expected that an employer will do this. Strategies for managing noise exposure, okay? And this follows the hierarchy of control, which I'm going to review in a few slides. So strategies for managing noise exposure are not about using hearing PPE. That is just one small component. There's a whole guideline of how this should be done. Then it also gives some guidelines on what are the medical surveillance required, or what are the medical assessments required to monitor for effects of noise exposure. Then reporting and compensation guidelines, because once you do all these work, certain reporting is expected. And if things go wrong, compensation is also expected. Now, definitions, so that we are all understanding what we are talking about in terms of we are the same level. This is a simple comparative chart to show you how noise is interpreted in what we call decibels. So in a quiet room, that is typically about 30 decibels. So for example, This room I'm in right now, my kids are here also working. There's rustling of papers and chairs a bit, but generally it is considered a quiet room. When you have light traffic, we get to 50 decibels, and that is moderate. When you have noise levels near a big highway, we call that loud, okay? Or a busy crossroad. And when you are around trucks and motorcycles, we get to 90 decibels, and that we consider very loud. And then in countries with a subway, they talk of 100 decibels. But generally, when a car is hooting, that is about 110 decibels. And when an aircraft is taking off, that is about 120 decibels, and that is considered extremely loud. Now, we have what are called permissible exposure limits for noise. These are guidelines to help us understand at what level is noise a problem or what is permitted. Now, our Act does not go into defining with a lot of detail. For example, the National Institute of Occupational Safety and Health Services in the US, which is where this chart is coming from. So again, generally when we are working, we usually want to reference international best practice. And generally, that's where we guide our clients to get to what we call international best practice. Now, based on the decibels, we typically have a cutoff of 85. Okay, so by the time we're getting to a sound level of 85 decibels within a working environment, we're saying that that needs to be a monitored environment. The workers need to be monitored, and they should not be exposed to more than 8 hours per day. Otherwise, they will end up with permanent hearing loss. If we cross to 86 decibels, then what you see what happens is that the total time of exposure per day comes down, and such that by the time you're getting to 100 decibels or above, we are saying that there should be literally no exposure to noise levels of 100 decibels and above. So for example, no one should be exposed to the noise levels of an aeroplane taking off, because that noise level can cause permanent hearing damage, even when it happens for a very short time. Remember, we said an aeroplane taking off is 120 decibels. I've gone back one slide. So you can see here we are actually at 112, and we are saying 0 hours per day. By the time we are getting at 100 decibels, we are talking of less than 0.25 of an hour, okay? Or approximately less than 30 minutes. Now, sorry, less than 15 minutes, a quarter of an hour. So this permissible noise level exposure should guide how you operate your workplace after you have conducted a noise survey. Now, if noise levels are too high, we end up with a problem we call hearing loss. If people are exposed to high noise levels for prolonged periods of time, there is a potential for them developing hearing loss. I'm using this picture to help you understand how we define hearing loss in a simple way as possible. Now, you can see the shape that looks like an ear, okay, on the left side of your screen. And you can see the outer ear or the ear canal. Now, whenever we have hearing loss arising from the outer ear or that section labeled as the middle ear, we call this conductive hearing loss. And conductive hearing loss is hearing loss that arises because of problems of conducting the sound waves. That is where the term conductive hearing loss comes from. But once you cross into the inner ear, we call that sensorineural, which is basically hearing loss that involves the neuronal structure or the nerve structures. And there is a sensorial component that is not, that is interfered with. Generally, in the space of the occupational sphere, we almost always start with conductive hearing loss, but when it is not dealt with, it progresses to sensory neural hearing loss. Therefore, that also can tell you that we do expect that sensory neural hearing loss is coming later and tends to be permanent. Okay. There are a few cases where you can start off with a sensory neural hearing loss first, but most of those cases are not occupational related. So we are still doing some definitions, okay? Then we come to a noise survey. So this is when you measure the noise levels in a workplace as people are working. And what you're trying to determine is to how many decibels are the workers exposed in that particular environment. Now, there are multiple ways of doing this, but generally it uses a gadget similar to the one you're seeing that measures the noise levels, giving a digital readout. Many times you'll also get a printed report which links the decibels to the time of the assessment. It is also recommended that this is done in a proper manner, because you can imagine you could have a grinder. You could have a grinder in the workplace. When the grinder is off, the noise levels are low. When the grinder is high, the noise levels are high. So if the person doing the hearing, the noise survey does not know that, then they might easily miss completely. They might get the wrong information because they might only measure when the grinder is off. Or maybe the day they come, the grinder is not working. The repair is ongoing, and they imagine that that workplace has a normal noise levels or acceptable noise levels. So the noise survey is done by experts who know what they're doing, and it involves getting some background and visiting the site, inspecting, and many other things, just to make sure that they get an objective measurement. Then, just to help you understand, this is what we call a sample. This is a noise survey. This is actually a noise survey from one of my clients. I've removed the name so that we don't interfere with them. But just to show you, once a noise survey report is compiled, what we are generally looking at. So you must name the location or the position or the place where the noise survey was conducted. You must indicate the current noise level in decibels. And of course, this is based in time, so it can't be arbitrary. It is at a specific time and place. And then the standards or the levels of noise that are permissible must be listed. And here you see they have listed 90. And you note the number of employees exposed, because those are the same employees who are going to need medical surveillance or routine surveillance to check their hearing loss, effects of noise exposure such as hearing loss. And then there are remarks, so you can see where we have the air suppression, point number 11, at 67.5 decibels. That is noted as within acceptable limit. Now, let me point out, because I might forget to do that, this does not necessarily mean that 67.5 is a good level of noise, okay? It is just based on the permissible exposures. People working at that noise level of 67.5 could also be experiencing health effects, but it is not likely that those health effects are going to be hearing loss. And that is another long conversation we're not going to get into today. Now, you see, interestingly, notice board side, which is right under air suppression. On the notice, you expect more noise at the suppressor, but on the notice board side, there is actually very high noise levels. And people might not be cognizant that the notice board side could be having a problem, okay? So we are seeing here, out of this chart, the highest noise level was bulk loading under high pressure venting, which is 98.7, okay? Now 98.7, if you remember, let me go back so that you see the previous chart that I talked about. If you remember, the amount of noise, 97, is they should be exposed to a level of 97 for less than 30 minutes in a day, okay? But this is a place employees are working every single day. So you can imagine a number of these people might already be having hearing loss. especially if no additional measures are taken. And in a workplace, generally, if you find a noise of 98.7, it means that the measures that have been taken to manage that noise are still probably not adequate. And I'm going to talk about the measures in the next slide. Now, when we talk of controlling noise in the workplace, we refer to what we call the hierarchy of control. And this is applied in managing all kinds of hazards, not just in the occupational health space, but in other places as well. Now, we start with the most effective at the top is elimination. And then we come down to the least effective, which is PPE. But as you can imagine, a lot of people and a lot of workplaces start with PPE as the first measure, which is really about that's an approach that arises out of ignorance. So the first thing is you look at elimination. Is there a way to get rid of the noisy machine or the noisy process? If there's a way to get rid of that, that is the most effective measure, because it means if you do that, no one is exposed. Next option is substitution, okay, which is less effective than elimination. And this is a way to change the noisy process for a quieter one. So maybe, for example, the team uses a grinder in the workshop. Is there a way to achieve the same effect without using a grinder? Okay. Coming down, then we talk of engineering controls. And this is, for example, in the case of the workshop, it's very easy. We talk of using insulation. You insulate the noisy machine. So you can, newer grinders, for example, will be better built and better insulated. Just like modern aircrafts. If you fly to Juba is when you realize that there are some very loud planes, because there are a lot of old planes in Juba. And it's amazing how loud they get. But modern aircrafts are built in such a way, not just insulation, even the design of the engine is done in such a way that the noise is managed at source, at production, okay? So all these are engineering controls. Another engineering controls I've seen in many companies is where they have a compressor, and the compressor is built, a case or a container or a cage is built for the compressor, and the cage is insulated so that the noise of the compressor stays inside, it doesn't come out. Then we come to administrative controls. Now, these are controls that involve people. So administrative controls always involve people. And of course, you can see they are at the bottom of the effectivity list, because anytime your control involves people, it means that you are relying on them following instructions for the control to be effective, which is not an ideal situation. But almost all hazards have an administrative component in their management. So in this case, for example, you can limit the number of people working in the noisy area. And then finally, you provide PPE. So PPE is like, for example, individual hearing protection. And PPE is provided when you've taken all the first 4 measures, but the residual noise is still a concern. And the unfortunate, or rather the disadvantage of PPE is 2 things: that the PPE only supports one individual. It does not support more than one. Okay, so if you have hearing muffs, for example, they are only for one person. And number 2, PPE is usually the most expensive measure, again, because it typically is only for one person. I hope we are together. And in case you have a question, feel free to put it in the chat. You know, sometimes you have a question that is burning and you don't want to forget. You can put it in the chat. Now let's look at the guidelines. What are the guidelines for the medical examination? So you've done a noise survey. You've noticed there's noise in the workplace. You've used the hierarchy of control to manage the noise. You've done your best, but there is still some residual noise. You've given people PPE. Now, because there's still some residual noise that is above 85 decibels, you then must undertake annual medical surveillance for your employees. So what are the guidelines that you need to follow? And this is something I found most companies do not understand. And that is really one of the reasons I have prepared this talk. So first, there are types of medical examinations. There's what we call the general medical exam, and then there's the audiometry assessment, which is the hearing assessment. A number of people confuse the two, and they tend to think that actually what the law requires is just the audiometry. But that is not accurate, because before you can look into someone's ears, you need to first confirm that they are healthy. I'll give you an example most of us can relate to, because we have maybe come across this. You can't go to the garage and change the oil without changing the oil filter. Okay, the two things must go together. Now, with the general medical exam, we're able to see or assess, excuse me, we're able to assess the overall health of the individual, and we're able to know if there are any other contributing factors to this person having a hearing loss or that kind of thing. We have seen people who have hearing loss, not because there's anything wrong with their ears, but because they have another medical condition. And common here is early onset dementia. So in Western countries, especially where you have the population working until they are mid 60s or late 60s, sometimes early onset dementia can be confused for hearing loss. Another example are structural deformities. So you have someone maybe with excessively large tonsils, either from an acute infection, but usually from an acute infection, the problem will go away and then their hearing will come back to normal. But if you have enlarged tonsils due to a chronic reason, that can actually interfere with hearing. Another common one we see is wax, what we call wax impaction. So you have excessive wax in the ears that has crusted and dried up, and it literally forms a plug within the ear canal. So the general medical exam looks at the overall health of the person, and then the audiometry is a specific measurement for hearing capacity. Now, the outputs of these exams is what we call a certificate of fitness, as well as a printed audiogram. Again, this is a place we are seeing a lot of challenges, because employers sometimes are getting medical exams done by people who are not licensed or qualified, and they are told employees are normal, but there is no printed audiogram. You should never have an audiometry without getting a printed audiogram, and you're going to see why in a few minutes. Now, if someone is normal, they get a certificate of fitness saying that they are fit for duty. If someone is not normal, or if there's a problem, they get a certificate of fitness noting that they are not fit for duty, and usually giving guidelines of what needs to be done next. And the certificate of fitness, in this case, I should point out, this is a government document. It is one of the documents contained within the OSH Act. Now, what is the frequency of these medical exams? Most important, in my opinion, is the pre-employment examination. And this is examination that is done before you employ someone into a noisy environment. And the reason you want to do a pre-employment is to actually confirm that they have normal hearing, because that forms your baseline. And then you have annual medical surveillance, which we call the annual examination. And this is to monitor those who are exposed to noise above 85 decibels, whether there's any ill effects of that noise exposure. And then finally, post-employment medical exams, because when people leave your workplace, you need to know that they left in good health, because they were working with noise and they might have been affected. So you need that evidence. And you also need to be able to communicate to them that, look, you have actually left our workplace in good health. Okay. Now, let me stress this, let me reiterate this, because I cannot stress this enough. Never, ever employ anyone to work in a noisy environment without first having undertaken a medical exam and obtained a printed audiogram. I want that to sink in. And you'll see, I'll show you a case study of how things can go wrong. The same rule applies if the employee changes jobs internally. So maybe initially they were not working in a noisy environment, but now they've been promoted and they moved to a noisy environment. you need to confirm that they have normal hearing. And even if they don't have normal hearing, you need to know that as your baseline before they get into that new rule. Now, this is what we call a normal audiogram. And this is from one of my clients. I have hidden their name there because that's not the focus of today, okay? And the audiogram looks at the right and the left ear, and we do what is called air conduction. So for the sake of workplace screening, we do not do another aspect of this test called bone conduction. We only do air conduction. And we check for hearing, and you see the examiner concluded that there was bilateral normal hearing. But also there was a bit of a health history, and the patient indicated they have never had any serious issues with hearing at or and before the above hearing assessment. Okay. The noise level of the room is also important to point out, because the ambient noise in the room where you are doing the medical examination could interfere with your results. So the sound levels in that room must be determined and noted as well, because that could have implications on how you interpret the result. Now let's go down where it says right, okay? So you see on the left axis, you have, let me see if I can put a pointer here. I think I should be able to put a pointer or a mouse. Please confirm if you can see my mouse as I move around.
Yes, you can see.
You can see. Good. Thank you, Abdulkadir. So on the left side, we have the hearing levels in decibels, and we have the baseline 0, and then we come to 10, 20, 30, 40, all the way to 110. And then up here, we have the frequency in kilohertz. And for us, our assessments are done at 500 kilohertz, 1,000, 2,000, and 4,000. Okay. Now, this table down here is giving you the same results. So you see for the right ear at the bottom here, it says at 0.5, which is 500 hertz, we have 15. That is that point, 15 decibels. At 1,000 hertz or 1 kilohertz, we are at 15. At 2,000, we are at 10. At 4,000, we are at 15. So this is the left ear. So the right ear is always indicated with zeros. The left ear is always indicated with an X for air conduction. It's a bit different for bone conduction. And again, using the left ear, we're able to see at 0.5 or 500, we were at 15 decibels. Then at 1,000 kilohertz, 1,000 hertz or 1 kilohertz, we move to 10 decibels, then 15, then 15. So this is a normal audiogram because generally it is considered that normal is 25 and less. So 25, 20, 15, 10, 5, 0 is, well, it should not be 0. So it's considered normal, okay? Once it gets to 15, we start talking of abnormal. And this one shows you abnormal because you see here on the right ear, we have 15, 15, 15, okay? And on the same table here, you see 15, 15, 15, and then we drop to 35 at 4 kilohertz. And that's the drop you see there. On this side, for the left ear, we have 20, 15, 15. So 20, 15, 15, then we drop to 50 decibels. So we call this bilateral normal hearing with moderate hearing loss in the 4 kilohertz range. And this is a pattern very typical with noise-induced hearing loss. Okay, so this person actually most likely has what we call noise-induced hearing loss. Whenever we find an abnormal audiogram like this, a bit of an investigation needs to be done to determine could there be other reasons for this hearing loss. And I'm going to guide you through that kind of thing in a minute. Now, whenever we're doing whenever we're looking at a hearing loss audiogram, we need to consider what we call or look for what we call a standard threshold shift. Now, this is defined as a change in hearing threshold relative to the baseline audiogram for that employee of an average of 10 decibels or more at 2,000, 3,000, and 4,000 hertz in one or both ears. And this is a definition, again, I borrowed from the American occupational standards, because again, our law does not get into this detail of definition. What is important for you to understand that person had a hearing problem when you employed them, but you did not do a baseline audiogram. If you later find a hearing problem and compensation is being discussed, it will be assumed that person had normal hearing and that their hearing loss has occurred in your workplace, which would be very unfortunate if that is not the case. And the only way as an employer you can prove that that is not the case is because you have a baseline audiogram. Now, we are generally concerned with the audiogram if the hearing level is 25 decibels or more above the audiometric zero, which is the zero line I showed you, again in the same 2, 3, and 4 kilohertz, either in one or both ears, as the ear you find a standard threshold shift. So, if, for example, let me go back one step. If, for example, you find a standard threshold shift from 10 to 20 or 10 to 25, that is not significant because it has not crossed 25. But if you find from 25 to 35, that is a concern. I hope that is clear. But anyway, this is not your work to do, so I'm just sharing this for the sake of your understanding, you being the persons working in the sector. This is what a standard threshold shift looks like, okay? So the light line you're seeing, that is the original audiogram, whereby you see at 1,000, we were at 15, at 2,000, we were at 25, at 3,000, we were at 35, and at 4,000, we were at 45. When this audiogram was done a bit later, so what they've done is they've superimposed one on the other, just so that you can understand this. When it was done later, you see at 2,000, it dropped by 10 units from 25 to 35. At 3,000, it dropped by 10 units from 35 to 45. At 4,000, it dropped by 15 units from 45 to 60. And at 6,000, you see it even dropped by more units. And at 8,000. But generally in the field, we don't go beyond 4,000. It is when they go to see the specialist that they are going to get 6,000 and 8,000 kilohertz assessments. Now, you won't see generally an audiogram looking like this because the audiograms are done at different times. So the person reading the audiogram will draw a table where they pick the values of the first audiogram and they record them on a table. They pick the values of the second audiogram at different frequencies, record them on a table, and then they do a subtraction. So when you're looking at a threshold shift report, it will usually be in a table form, but with the audiograms attached. Now, what next then if you find an abnormal audiogram? So it depends on the degree and the rate of development of the hearing loss. So this is what your experts like myself or an ENT specialist are going to guide you on, okay? You must consult the baseline audiogram. So if there's no baseline audiogram, then that's a big challenge. This person must also be referred to an ear, nose, and throat specialist for a detailed ear, nose, and throat examination, so that as much as possible, you can determine if there is any other reason why there could be hearing loss going on. Of course, on the other side, remember you have your noise survey. You know this person works in a noisy environment, and you know how many decibels that environment is. Now, you get a written report from the ENT noting whether this hearing loss is permanent or not. And the ENT should also give you probable causes. So again, this person should not come from an ENT without a written report. That is absolutely critical. So even at the point of referral, it must be made very clear to that doctor that a written report is a must. Now, if the hearing loss is not permanent, you consider measures like changing the workstation and allowing time for recovery. Of course, if you allow time for recovery, there has to be a repeat audiometry to check for resolution. And in my practice, I have seen a lot of that. Individuals who get hearing loss, we confirm it's hearing loss, we change the environment, and it goes back to normal. So hearing loss usually doesn't occur from zero to permanent just like that. It gradually builds up unless the initial noise was so loud that then you have an injury to the ear. But even those injuries sometimes will heal on their own or after surgery. Now, if the hearing loss is permanent, you need to now undertake Weber compensation process. And of course, that case must be reported to the director, currently called the secretary at the Directorate of Occupational Safety and Health Services. That is a requirement under law, which if any of us breaks are liable to persecution, or not persecution, to prosecution. Okay, good. Now, how then is this Weber calculated if things go wrong? And I'm hoping this will make you realize you do not want things to go wrong. The Weber calculation is based on the definitions given within the Act. And let's assume an employee earning a salary of 65,000. This was a typo, let me correct that. Assume an employee earning a salary of 65,000 a month, okay? Has no allowances and is diagnosed to have a noise-induced moderately severe hearing loss in both ears, not 1 year. The Weber Act gives guidelines of what percentage of permanent disability that comes to, and generally, moderately severe permanent hearing loss in both ears will come to approximately 25% permanent definition of permanent hearing loss. Now, the calculation of compensation, okay, is based on the salary, and this is what happens. You take the salary, you multiply by the percentage of permanent disability, which we've said is 25% as guided by the Act, times 8 years in months. Okay, so 8 times 12 gives you 96. So the compensation is based on 8 years. And you divide by 100 because this 25 is 25%, so it is 25 over 100. And when you do that calculation, you discover that this employee should get a compensation of 1.56 million Kenya shillings for the permanent disability arising from the complete hearing loss in both ears. Again, as you can see, this is not a small amount of money. And this was a completely preventable situation. So you want to do your best to not end up at this point. Case study 2 was actually in the news, and you can go and look at it yourself in your own time at the Kenya Law Review. The link is at the bottom, kenyalaw.org/case law/cases/view/number 153828. So this is public, this is in the public domain. But this clipping is from the newspapers where they wrote about this. A welder was awarded 7.9 million for loss of hearing by Bamburi Cement. Okay, and when you actually read the case from the Kenya law, the magistrate was very, very upset with the company because a lot of things that should have been done were not done. Okay, and these are the kind of things we really want to communicate to all of you are completely avoidable by following the law and cost a fraction. It actually costs a fraction to do the right thing than ending up with one of these cases. So once we are done, Abdulkadir, Esther, and everyone else, I would like to share some documents with you. In case you don't have them, please let us know in the chat, and you can also share your email. Legal notice number 25 that I've talked about, and the Occupational Safety and Health Act of 2007. But again, these are also in the public domain, right? And do let me know if there is something else that you think I should share. We have recorded this session and we are going to host it on our YouTube page so that you can go back to it later at your own comfort, and you can also share with others who might find it useful. So thank you for your time, and I would now like to allow about 10 minutes for any questions, clarifications. Feel free everyone, just unmute yourself and go ahead and ask any question you might have.
I have a question. First, thank you for the interesting presentation. It says a lot about the responsibility management of a company gets, and what they're supposed to do, and what can happen if they don't do what they're supposed to do. But my question goes more on lines of you as a DHP or other safety officers and the regulation. I'm not sure if this is the case, but are you as a medical officer obligated to report any you do test and you find out that there are some hearing lost among some of the workers? Are you obligated to report this to DOSH, or is the company management that is obligated? Because for company management to do that reporting, where they can risk fines or compensation for millions, somebody also will try to be smart and maybe not do it. But are you as a designated health professional, are you obligated to report it to DOSH?
Now, the answer is yes, we are obligated to report it to DOSH. And even beyond that, the law is very clear. Any medical person who comes across a patient in whom he suspects an occupational illness or occupational disease is mandated to report it to the director. So even you, Abdulkadir, if you walk into Nairobi Hospital today and the doctor who sees you thinks that you have an occupational illness, they are required to report it to DOSH. That is the law. And if the director finds out that this doctor knew and did not report, the law has guidelines of how that doctor can be prosecuted. Okay. Now, the challenge we have in this country is two things. First, most medical people in this country don't know anything about that law. And I'll confess I was one of them. Until I became a DHP, I had no idea about that law. Okay. And the requirement within the law. And I can tell you there are many doctors out there seeing occupational illnesses that don't know anything about the law. But secondly, even for us as DHPs, remember the work we do is paid for by the company. So I do medical exams in a company, I find a problem, I am expected to report, but at the same time, I'm also hoping the company will pay me for the work I did. So you can see that kind of pull and push environment, which is very unfortunate. It's not easy because, again, the government cannot pay the doctors to do the work, because if the government could pay the doctors to do the work, that would be the best approach. Or if the companies can contribute to a fund such that the doctors are paid from the fund, okay, which is actually what is happening in a number of countries. And even in Kenya, they're exploring how that can be put in place. They're actually already discussing. So to answer your question, yes, we are required by law to report any suspected occupational illness. Note I said suspected. The process of confirming is followed by DOSH. Any other questions? Hi, Cyrus. You sound very far. Please speak up.
Oh, okay. Hope it's not a bit clear.
Let me increase my volume. Go ahead.
So my question is, going with the new way of working, whereby nowadays, due to COVID, we are seeing that nowadays meetings are online, even this one. We have scenarios whereby we are seeing now majority of the workforce making use of earphones just to log into meetings. So in long term, when you look at it, will it have any impact to their health, or how do we approach such a scenario?
Good. That's a very pertinent question, Cyrus. There is a possibility. We can end up with problems with hearing because of earphones. You can imagine someone who is doing back-to-back meetings all day, okay? But generally, also you've noticed whenever you put in earphones into your computer, for example, the system is built such that the volume is reduced automatically, okay? The noise produced by most earphones, especially in a meeting environment, is rarely beyond 55 decibels by estimate, okay? The kind of earphones that cause problems usually are more related with recreational use, especially music. There's also a possibility of poor quality earphones producing a kind of noise that is detrimental to the ears. But it's a valid concern, but I don't think that it is going to be a significant issue for the majority of people. Just to also put things in perspective, when we do come to do medical exams at your workplace and we are coming to do audiometry, we encourage or we advise employees not to use earphones that morning, because you know a lot of young people these days, they're using earphones constantly, listening to music from their phones. And if they come with earphones, they have been listening and then they come for the audiometry test, there's a possibility that the noise of those earphones could interfere with the results of the audiometry test. And generally, that is also why many times when we find abnormalities that are not severe, you know, someone has a 30 decibels, 35, you know, just below 25. We often advise them to come for a repeat at a different day so that we eliminate such external influences contributing to the abnormal results. I hope that answers your question, Cyrus.
Yes, it does, and thank you.
I have a simple, practical question.
Yes.
Somebody is working with a grinder, and all precautions are taken for that person. In most cases,
Yes.
maybe they have head ear props or something like that. But how much is you can say second-hand effect, like in smoking? You smoke, somebody else gets sick, and the one who smokes, it has a lower risk than the one who is breathing in it from a distance. So, how much of an effect will that affect also in noise issue when somebody is working with a grinder and somebody else is working a few meters away?
Yes, that's a very pertinent question. And in fact, when a noise survey is being done, they have to consider such factors, because the person using the grinder, in many places, many companies or organizations, you're going to find that the person using the grinder has hearing protection. The person working 2 meters away, literally almost they can touch each other, has no hearing protection because he's not using the grinder. The person who will actually go deaf is that one without hearing protection, not the one with the hearing protection. So the noise survey should consider all those factors and look at who is within the vicinity. So for example, one of my clients that I remember very well, the first time we went to see them, they're an American company, so they have an open plan warehouse, factory floor. They have an open plan factory floor, which is very popular in the US. But they were using a number of grinders, and the noise was going all the way to the office. Even the people sitting in the office behind a wall had too much noise exposure. So we help them understand that the noise is affecting everyone, not just the person using the grinder. So that's a very common problem, and it causes a lot of hearing loss because the non-technical people, and this happens a lot in companies, for example, that don't have a safety officer because they have no one technical who is able to understand and advise. So they mistakenly imagine that the person who needs hearing protection is only the one working with a grinder. So that's a very pertinent and common occurrence. Another, Abdul Kadir, another example is compressor. You have a compressor within a factory. It is at the corner of the building, but the noise of the compressor goes all the way even outside. So that's another example where everyone will be exposed, yet nobody is working directly with the compressor. So the solution for that one is usually simple. Move the compressor outside the building behind the wall, and then build an insulating room for it so that the noise is contained. Or if you have money, buy a modern compressor that is not producing a lot of noise. Any other questions?
Hi, just another question.
Yes, Cyrus.
That has just come up. So, how do you differentiate in terms of noise that has been caused the work environment, and also how do you differentiate it compared to maybe the person on his way commuting to work and back uses the common PSV matatus that usually have high audio on a daily basis? So, how will you now draw the line?
Correct. Good. Very, very pertinent question. It's a common problem and one that you cannot actually solve. Okay. I'll even give you a more worrisome example. Maybe your employee is a budding DJ. He's a part-time DJ. So Friday, Saturday, Sunday, he's in the club making music, and that is his side hustle. And then on Monday to Friday is at your workplace. Then he gets deaf. And most likely, his deafness is from the DJ work, not your workplace, but you might not even know. Okay. Now, there are very few ways. There's no really major practical way you can differentiate noise from out there in people's home and other environment, or noise in the workplace. So what you need to do is you need to take all the necessary measures in your workplace so that it is clear that you are not liable. Okay, so do a noise survey. You might be surprised to discover that the noise within your workplace is below 80 decibels. So if your noise is below 80 decibels, the director at DOSH cannot hold you responsible for hearing loss. But remember, you must be having a noise survey done. You must have the evidence that your workplace has noise below 80 decibels. The other thing is, if you have noise above 80 decibels or above 85, then you take measures to control that noise. And of course, those measures are going to be recorded, and all the way to providing PPE for staff. Then remember, we have the baseline audiogram or the baseline audiometry. You know the state of health of this person when they came. Maybe they were deaf when they joined you, but because you didn't do an exam, you never knew. And then finally, there is a medical surveillance on an annual basis. So when you take all these measures, if your workplace is not harming the employee and they still develop deafness, then they will have to work with their doctor to determine what is the alternative source of that hearing loss. I hope that's clear, Cyrus.
Yes, it is, and thank you.
So this principle applies for many medical conditions, okay? Because someone else might be exposed to inhalational hazards in the workplace, but they're also a smoker, which is a choice. Someone else could be having back problems, okay? And they blame the workplace, but maybe at home they're doing other things that involve heavy lifting, or they got injured at home and they don't know. Okay, so you can't manage what happens in people's home environment. What you do is you manage what happens within your work environment, and that way you are covered. Good. Any other pressing question? Excellent. So I think we are satisfied. Now what we need to do is to apply these principles. Please share with us your email address so that we can send this out to you. We can send you the details of the recording. Let me put our email address so that you can even send us directly. Okay, your email address. That way we'll be able to share with you the details of this presentation. So I've put in our email address in the chat. All of you can see it. You can note it down before we close this presentation. Thank you so much for your time. It's been a pleasure. I think it is the 15th of June. Let me confirm the date again, just for your information. The next talk is going to happen on the 15th of June, and we shall be discussing lung function assessment and its implications. So just like hearing assessment, there's also specialized assessment for lung function. And again, a lot of misunderstanding in the industry of what is done and what the implications are. So I hope we can be able to resolve some of those. So thank you very much. Have a lovely evening, and we hope to see you on the 15th of June. We shall send you a reminder.
Thank you very much, and have a nice evening too. Bye.
Okay, you too. Bye-bye.
Thank you for the presentation, Dr. Dennis.
Karibu. Thank you.